You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what every parent needs to know about orthodontics. With us, we have a local orthodontist here in Carlsbad, Dr. Taylor. Dr. Taylor, welcome to the program.
Thank you very much for having me.
Now, for people that don't know you, tell us a little bit about your practice and how long have you been here in town?
Well, I'm a resident local native of Carlsbad.
Okay.
Been practicing now for about 7 years.
Okay.
I opened a partnership practice here in Carlsbad with my partner, Dr. Parmees Sianit. She's a native to San Diego. We both wanted to come home and be able to take care of our neighbors and our community. Our practice, we've been open for about 3.5 years, and we've been growing. We've been really pleased. We've been growing really fast. Patients are referring their friends and family, and we have a patient-centered practice where we try to get the best experience and the best quality of care.
And who is your typical patient? Is it mostly children, teens, adults?
We have a little bit of everything. I'd say it's about 30% adults, and then we start seeing patients from about age 7, and average age starting treatments around 12. So we have the whole spectrum, but about 30% adult, 70% child or adolescent.
Okay, so let's begin. I'll start with some questions I wrote down here. That at what age should somebody? A lot of kids I see very young with braces. Is it necessary, and when should somebody do something about it? When should a parent take their child in to get evaluated?
We would like to see children starting at age 7. That's the recommendation from the American Association of Orthodontics.
Okay.
That said, not every child needs to have braces at age 7. Okay. I have parents all the time asking me, I see every one of my children's peers with braces. Is that necessary? No, it's not every child does, but some kids do. And we'll see them at 7. Sometimes there's not a problem. We'll just watch, make sure they're growing and developing properly. And occasionally there are problems that do need to be addressed, and addressed sooner than later so that the problems aren't irreversible.
And what are the benefits of going in early?
Self-esteem is a big one. There are a lot of kids who come to us and say that they don't smile, or their parents tell us that they don't smile because they're ashamed of their teeth.
So the actual children will confide in you and say...
We'll ask them to smile, to see their smile, and they're closed-lipped and they don't. Or I ask them what you don't like about your teeth, and they say everything. I hate my teeth.
Oh, wow.
Or I have this tooth and kids make fun of me. Every week we hear children say kids make fun of them.
Kids make fun of them. And the parents probably don't even know that.
Sometimes they do, and I've had parents cry when they hear their kids say it.
Interesting. So the big benefit then is the self-esteem.
That's one of them.
To get them in. Mm-hmm. Do you have to wait until the permanent teeth come in?
Not to have a checkup, no. And it depends on what the problem is. There are some problems that we get fixed before permanent teeth are in, and there are some problems where we have to wait for the permanent teeth. So I wouldn't wait to get a checkup until the permanent teeth are in. If your child's around 7 or older, I would get seen by an orthodontist.
But you can get braces on before your permanent teeth come in. Is that right, or no? Do you recommend that, or you don't?
Not necessarily braces. There are appliances that may be placed, but not necessarily braces. We typically put those on permanent teeth.
Okay. And what's changed over the years, by the way, with orthodontics?
With the advancements in orthodontics, there are clear braces that blend in with the teeth. There are clear aligners. People have heard of Invisalign as a typical name. And there are braces that go behind the teeth. There are a lot of advancements.
Do you do all of those things?
We do.
So the braces behind the teeth, they call those what? Invisible
lingual
braces? Lingual braces?
Lingual, on the lingual surface of the tooth.
More so for adults?
More so for adults. It's a cosmetic choice. Okay. And more often kids want the colors. They want to have fun and let people see their braces. They're proud to have them. A lot of adults want to hide them. So what are the signs then? A parent, so you're looking at your child. When should, obviously they get in there earlier. You say 7 years old, 8 years old, just to get, but what's wrong with just going to the regular general dentist? Maybe nothing wrong with it, but why, an orthodontist has spent 2 to 3 years in residency after dental school, specializing in jaw position and tooth position and healthy bites, aesthetic smiles. And we see every day problems and know how to address them. The dentist doesn't always see those regularly, and the dentist will often refer to an orthodontist for the evaluation.
Is that how you get most of your referrals?
We did when we first opened our practice. We got them from the dentist. Now we're getting them from dentists and from patients who refer their friends and family.
Okay, and what about like bite issues? That's an easy one to spot for a parent. Overbite, underbite?
Not always.
No? Okay.
A lot of times we see the bite issue and the parent didn't have any idea. And you want to use growth to your favor on most bite issues. So the sooner an orthodontist can identify that, they can plan the right time for the child to be treated.
Okay. Let's talk about self-esteem for a moment.
Sure.
You said this is a big interest of yours. Tell me about that, how important that is.
Well,
And the changes you see, I should say, also.
I did my research, my master's research on self-esteem. It's always been one of the draws to me why I went into orthodontics. I had braces. It made a difference in my life. And it's the most rewarding part of being an orthodontist is I get to help children gain confidence and respect and like of themselves. It's in our country, having a beautiful smile is important.
Okay.
Not only does a beautiful smile usually reflect a healthier bite, which is going to be healthier for the patient and the person throughout their life, but if it gives a person confidence, especially during the critical developmental years, you can imagine all the changes in their life. If they have more confidence in themselves. They may make friends easier, do better in school. There are a lot of changes that we see. We see patients open up throughout orthodontic treatment all the time.
Is that right?
Oh.
So they come in one way and then their teeth, as they get straighter, they feel better?
Think of lots of patients right now where they're different from the day we put braces on to the day the braces came off.
Interesting.
I love it.
What about teens? Now, is teen Invisalign, I mean, I see the commercials, teen Invisalign, is that hot?
Patients
or
come
not
in,
so much? Or would you like to see more of those patients?
I love seeing patients who come in wanting teen Invisalign. They're showing interest in their teeth and they want to do something to change it. It's a great form of treatment for a lot of people. Not everybody's a candidate, so you have to go in and see if you are. But if you're a candidate for it, it can do great things, just like braces can do great things.
What about adults? 30s, 40s, 50s?
There's no age limit.
But do you see that a lot? I mean, is it becoming more popular?
Absolutely. Patients come in all the time that are adults. And we've treated people in their 70s and 80s. My partner and I, yeah.
Really? What? Now, with orthodontics?
Yes.
So what, to people watching this too, adults, when should they see an orthodontist? Maybe they're in their 30s, 40s. I mean, who's the typical patient that's an adult?
Someone who's come in and says, I've never liked my teeth. Can we do something to change it? And absolutely. We can move a healthy tooth and healthy teeth at any age.
Okay, now what about time frame? If somebody, let's say they wore braces, bottom teeth, and they've shifted, how soon could they be in and out of braces? If it's an easy one, that means they used to have straight teeth and all of a sudden the bottoms go crooked. I'm asking this for a friend, by the way, that asked me.
It can be as short as several months, depending on what's going on. And it could be an Invisalign case, it could be braces. It depends on what we see.
Okay, good. Final message. You know, you knew you were coming here for an interview. Is there anything we haven't talked about that you wanted to make sure that you mentioned on this program?
I would find an orthodontist that you feel comfortable with and someone who really cares about you, because it's a big part of your life and you want to have a great result. You're doing it obviously to get a beautiful smile and a healthy bite. You also want to find somewhere where you're comfortable and you'll have a fun time, because you don't want to regret the experience. Okay, good. Do you have things set up in your practice to have a fun time? Games, things like that? We have monthly contests. We do Carlsbad Cash, which is a reward system for our patients who come in regularly, get their teeth cleaned by their dentist, have their teeth cleaned when they come in. Parents love it because their child's motivated to keep their teeth clean. So we do prizes for that. We do patient appreciation parties. We try to think of ways to make it fun all the time so that patients are motivated and gives them the best result. Very nice. Dr. Taylor, I want to thank you for coming on the show. Thank you. Very interesting. Appreciate it. And your website, they could... CarlsbadVillageOrtho.com. Easy to remember. Okay, thanks. Thank again. You. You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.